Bill, let's talk about a specific example that you'd like to highlight in your joint organization over there.
Yeah. So George was just talking about data and how much there is. So what we're doing is bringing primarily DoD and VA together with a common record about the patient, right? We're in the middle of transitioning to a cloud environment. Had a conversation about it yesterday, and just a portion of what we're bringing over the cloud was 3 petabytes of data, right? So lots of data. The other thing that we're doing is we're tying, right? We're creating a single record. So we've got that longitudinal record about the patient across their experience through the DoD and the VA. But what we're also doing is bringing community care in. We've created something called the Joint Health Information Exchange, where DoD, VA, Coast Guard, NOAA have become the world's largest exchanger of health information. When you look at a chart of all of the data being exchanged through the various national and regional health information exchanges, you can't see the other participants if DoD and VA and the Joint Health Information Exchange are in the chart. You have to take them off to change the scale so that you can see where other people are. So tremendous amount of data. We bring it all together, creating probably the most comprehensive record available anyplace. So it's what we're creating here is extraordinary. But I heard Wes talking about, I think it was Wes, maybe it was George, talking about what do you do with all that data? How do you reduce the cognitive load? So it was Wes. So we're looking at bringing technology in to, it's called seamless exchange, but to bring technology in to do that deduplication and present the relevant information, because that's what happens. Everyone wants all the information, but how do you process all that information? How does a physician or a clinician of any sort process all that information? So we're bringing the seamless exchange in where we deduplicate the information, we bring provenance in, so you know where the information came from. And we're finding that the deduplication takes care of about 80% of the data. And so the promise of where we go with this is extraordinary. And I have a personal example that I like to use. I help with my parents' healthcare sometimes as an advocate and even occasionally a caregiver. I recall a year or two ago, I was in the hospital with my mother. She was having an issue she couldn't communicate about. I was talking to a doctor, and I knew we were failing when I heard this. And I brought something that had happened in the past to the doctor's attention. And she said to me, well, I guess I'll have to go back and dig through the notes and see if I can find something on that. Well, we're not doing the right job as information technology providers to the healthcare complex. If we have physicians who are spending their time listening to family and then saying they have to go back and dig through the record, we ought to be bringing the relevant, pertinent information to them as simply as possible so that we can use their highly trained minds and experience to help our family members and deliver the quality healthcare that we need.